Dr. Parth Patel, Research Fellow at the Institute for Public Policy Research. Parth, you heard my introduction there. You know, I'm not a doctor, but I'm a taxpayer, and I am somebody that's used both the NHS and I've used private medicine too over the years. I have to tell you right now, if I want a GP appointment, I'm probably, rather than queuing up at home in Kent to maybe get an appointment at 3 o'clock in the afternoon, I'm probably going to pay a private GP in London. That's not a bad thing in one way if it takes the pressure off. But how serious is this crisis? Am I wrong? Am I over-exaggerating?
Well, there's no two ways about this. The NHS is in a really challenging position. We're in a serious point. And the easiest way to really think about this is the NHS is struggling to deliver on its core, its founding, its principal function, which is a healthcare service that provides care at the point of need for anyone who needs it. And we're in a position where that's not the case. Sure, emergency services, if I have a heart attack, the NHS will treat me in pretty much a timely way. It's not perfect, it's worse than it's been before, but that will happen. But actually, if I've got cancer, as you alluded to, or actually if I've got a knee replacement, and my mum's 2 years waiting for a knee replacement, right? That's not quite timely care. So it's definitely in a position where the system is stressed and we need to work out, we need to navigate out of this. And you're right, it's going to be on everyone's tongue. Everyone's got a family member, a friend on a waiting list, if they're not on a waiting list already themselves. And it's a conversation that will dominate politics and it will dominate society, and it's something we need to work out.
Maybe even worse than you said, actually, because even a heart attack, now in many parts of the country, you ring an ambulance and the waiting times are longer than they have ever been. In fact, in many cases, people even with suspected heart attacks being told, well, is there someone that could drive you to the hospital? Our population has risen very, very rapidly since the year 2000. It was not something politicians had planned for, but that's a separate policy issue that I'm not going to discuss right here. But our population is set to continue rising and rising quite quickly. What do we put in place? I mean, I've seen what Sajid Javid has said. What do you make of his proposals?
So his proposals, the ones that have come out recently about reducing the elective waiting list, that's hospital treatment waiting lists. And he's put forward some targets, as you alluded to, and a couple of things that might help us get there. So the problem we have here is that the basic building blocks of health service, the NHS, just aren't good enough. You alluded to it earlier. The pandemic has precipitated this access problem. But actually its origins run much deeper. Compared to the size of our country, in the UK we've got some of the lowest numbers of doctors and nurses, some of the lowest numbers of scanners, MRI scanners, CT scanners.
And yet our spending on health. I mean, there was an argument pre-Tony Blair, I'm going back a long way, but an argument pre-Tony Blair that we were spending much less on health than, say, as a percentage of GDP than, say, our German neighbours, our French neighbours. And that was true, but it isn't true anymore, is it? So if we're spending the same amount of money as France and Germany, pro rata, why are we getting worse delivery? What is going wrong?
Yeah, so that's a relatively recent phenomenon. We have now slightly got up to that European average of the amount we spend on healthcare. That is quite new, but we are now. So the case is, well, why isn't it buying us the same as what it's buying the Germans? And that's partly a consequence of a decade of short-sighted policy. We've focused quite a lot on how can we just about treat everyone who becomes ill and not really thought enough about how do we stop people becoming ill in the first place. Prevention is so much cheaper than cure, and it's something we've dithered around for way too long. And that's something we need to think about a bit more if we want a sustainable healthcare service that does provide care in a timely manner for anyone who needs it.
At the moment, we seem to just keep throwing more and more money at the problem. And it is actually, I mean, that's, Boris Johnson's government saying one of the main reasons taxes are going up on the 1st of April is to put more money into the health service. I just don't think we're getting bang for our buck. Now, I know there have been a series of NHS reforms that have taken place. Some in the health service say there's been too much reform, but surely it needs radical reform, doesn't it?
The reform in the NHS is an old conversation. You could argue it's sort of...
And as soon as you say it, people scream, you want to privatise it. And actually, Labour did privatise about 5% of it in the early years of Blair's time.
The privatisation debate is modelled. There's a difference, and the hard truth is the NHS has been using the private sector capacity. It uses it today. It's used it for the past few years. It's been using it for the past decade.
And what's wrong with that?
Well, it's the symptom of a health system that isn't functioning right. Because ideally, if you're a publicly funded healthcare service, you should be able to provide those functions in themselves. So the fact that you're then outsourcing to a more expensive way of providing care.
So it's an even worse value for money in your view.
It is. That's a fact. It is worse value for money. So it's a sign of a symptom under stress. And it kind of goes back to those 2 points I made. One, the building blocks just aren't sufficient. We haven't got enough doctors, we haven't got enough nurses, but actually we haven't focused on preventing people getting ill in the first place. You alluded to ageing. Actually, the population is getting older, and the country will get older for at least the next decade. It's also a very unequal country. Both of those things lead to people becoming ill. Now, we can't stop the country aging, but we can help people age better, age healthier.
How big in Europe? I mean, we know about drinking, we know about drugs, we know about smoking and the risks associated. How big a problem is obesity?
It's a big problem. It's probably, you'd find a lot of people say it's the #1 public health challenge outside of the pandemic for this country and for lots of advanced democracies to be grappling with. It has all sorts of effects on society, but of course, making people more unwell, heart attacks, diabetes, strokes, all those things go up. And we need to find a better solution to the huge obesity problem we have. That's all the way from, is there a McDonald's on the corner of the local school, to how do we help people make better choices?
It's not easy, is it?
It's not easy.
And the waiting list of 6 million, how much higher can that go?
It's hard to say. There's a lot of scenarios planned, and Sajid Javid has plotted a couple of charts. They could go quite high. I expect that number will be higher before the next general election.
Do you have confidence in Sajid Javid?
He's only just started his job, so we'd have to see how he goes. But he will be judged on a lot of things, and one of which is improving access to healthcare.
Dr. Parth Patel, thank you.